Good morning, this is Professor Planas. I will be speaking to you about chapter 67 that talks about reproductive issues in the male. So for this chapter, we only gonna lecture about benign prostatic hyperplasia, which is a common disorder that happens in most likely in the elderly, but it can also happen in the young population. Okay. Benign prostatic hyperplasia is nothing else than enlargement of gland tissue in the prostate, and it blocks or reduces the flow of urine. So this patient most likely is going to have an issue in initiating voiding. All right. So as the prostate gland enlarge, it extends upward into the bladder and inward, causing bladder outlet obstruction, just like I mentioned. So it blocks the urethra, and the patient has a difficult time, trying to initiate urination. Okay. In response, urinary elimination is affected in several ways: urinary retention, urinary leaking, and incontinence. The increased volume of residual urine often causes overflow urinary incontinence. Of course, remember when I spoke to you about urinary incontinence? It's going to get to a point that the bladder cannot hold more urine inside the bladder, and eventually the patient has to, urinate. And they do this by leaking. Okay? Right. So the patient with a BPH or benign prostatic hyperplasia is no different to the patient with OAB. Okay? Urinary stasis can also result in urinary tract infection and bladder calculi, stones. In BPH, if BPH is not treated, it might result in backup of urine and cause gradual abnormal distension of the ureters, hydroureter, and enlargement of the kidneys, hydronephrosis. Some of the signs and symptoms that you will find with the patient with BPH or benign prostatic hyperplasia is difficulty in starting and continuing urination. So yes, they will have a difficult time trying to void. Okay. To determine the severity of the symptoms for a patient with BPH, the nurse most likely will ask about the force of the urinary stream. So initiating urination and the force of streams lead to the nurse to assess the severity of symptoms for a patient with BPH. Also, the patient is going to have reduced force and size of the urinary stream. So the patient is going to have a weak stream, a sensation of incomplete bladder emptying, a straining to begin urination. The patient is going to have elevated post-void residuals, or they can have dribbling and leaking, and sometimes, but very rarely, they can have hematuria. Most likely when you see the hematuria is because the patient hasn't got any treatment or is not aware that they have benign prostatic hyperplasia. This slide is pretty much self-explanatory. So we have to educate the patient diagnosed with BPH to avoid drinking large amount of fluids in a short period of time, especially when they are going out or at bedtime. Reduce the amount of caffeine and alcohol. Okay. Caution the patient to avoid drugs that can cause urinary retention. One of them is betaquinol, especially anticholinergic, antihistamines, antipsychotics, and muscle relaxants. So ideally here is to educate the elderly that if they have medications that can cause urinary retention, to always, confide them to the physician or to the nurse practitioner. Pharmacology in the patient with BPH. One of the classifications used in the patient with BPH is alpha-1 adrenergic antagonists. The medications are doxazosin, prazoxazine, tamsulosin or Flomax, sildonosin, and they also have one called heparin that is not here listed. An easy way to learn this medication is focusing in the last part, which is the seeing part. So seeing, prostazosin, losing. That's how I learned them when I was back in school. Okay. So this medication works to relax the smooth muscle in the bladder neck. So basically it works by relaxing the destrusor muscle, decrease pressure on the urethra, thereby reestablishing a stronger urine flow. Okay. The main side effect is tachycardia. The patient will be dizzy if the blood pressure is low, and they can faint. So always educate these patients. Um, when they changing if they have orthostatic hypotension, to change position slowly. Remember that they might be dizzy at the beginning when they change positions. Okay, so dizziness is a common side effect. Change position slowly and try to give them a bedtime. Right? Another classification of medication used in BPH is the 5-alpha reductase inhibitors. The medication listed here are dutasteride and finasteride. For the ladies that will be working in the hospital soon, whenever you are giving finasteride or dutasteride, make sure that you use chemo glove, because this medication can lead you to sterility. Okay, it can affect the fetus. So when you are handling this medication, handle this medication as a chemo medication. Okay, so make sure that you use chemo gloves when giving this medication, because it can lead to well, first of all, it's teratogenic. They are teratogenic. Okay, and they have been associated with women unable to conceive. Okay, their mechanism of action: they decrease in the size of the prostate gland. The side effects listed here: impotence, decreased libido, and gynecomastia. They can also lead to orthostatic hypotension and hepatotoxic. So whenever you're giving this drug, make sure that the physician, he orders the ASD or ALT, which are the liver enzymes. Okay. A key point here that I want to tell you is that the combination of this classification and the other classification I mentioned in previous slide, there are good treatment in the patient of BPH. They use them in combination for the patient of BPH, and they have great results. Just like I mentioned in previous slide, this medication, they can lead to orthostatic hypotension, as evidenced by low blood pressure, dizziness, and problems with balance. Okay, so educate the patient to change the position slowly. An important thing here is that these medications, when you are giving them, they might take up all the way to 6 months for the medication to start effects. Okay, so it might take some time. So educate the patient so they don't get desperate. Okay, just like I mentioned previously, whenever you are giving these drugs, try to use chemo glove. Be protected at all times. The females or any other nurse shouldn't be shouldn't be touching this medication empty hand, without gloves. Okay, just like I mentioned, this medication can be teratogenic. They can be absorbed through the skin. Pregnant women should not be touching these medications. Okay, so at the hospital, if you are working with this type of patients that they have this medication, ask the charge nurse to change your assignment and tell them that you're pregnant. Okay. Teach patient taking the dutasteride to take the capsule with a full glass of water, and do not open the capsule or sprinkle on food. All right. And also monitor liver enzymes. Transurrectal resection of the prostate. It is the most common surgical procedure for BPH. It is also very common in Nclex, and it's also very common in ATI. Okay. It is used. It is performed using a resectoscope similar to a cystoscope, which is inserted through the urethra and trims away excess prostatic tissue, enlarging the pathway of the urethra to the prostate and enabling a more comfortable voiding for the patient. Okay, so the patient is able to initiate the stream of urine just like a normal person. Okay, it is done under epidural or spinal anesthesia. Okay. When they do this procedure, once they are finished with this procedure, they will put a 3-way indwelling catheter, okay, to perform continuous bladder irrigation. I will put a video so you guys can know how to do, or at least have an idea of what continuous bladder irrigation is, okay? So the 3-way catheter is placed in to perform continuous bladder irrigation, which prevents obstruction of the catheter after surgery. Okay, the urinary catheter drains urine and allows inhalation of a continuous bladder irrigation of normal saline. The product used for irrigation, it is normal saline. Do not use any other product. Okay. Do not use dextrose. Remember that bacteria, they like sugar. So normal saline only. All right. The rate of the continuous bladder irrigation is adjusted to keep the irrigation return pink or lighter. So once the patient goes through the procedure and they start irrigating the patient, the return or the outflow should be pink or lighter. Okay. If you see bright red bleeding with clots in the catheter, the only thing that you have to do is increase the continuous bladder irrigation rate. Okay. If the catheter becomes obstructed, as evidenced by bladder spasms or reduced irrigation outflow, turn off the continuous bladder irrigation and irrigate with 50 milliliters of solution using a large piston syringe. In the event that there is still obstruction after you irrigate with 50 milliliters of solution using the syringe, call the doctor. Okay? Monitor for bleeding. So yes, persistent bright red bleeding unresponsive to continuous bladder irrigation and traction of the catheter or reduced hemoglobin or hematocrit, we have to report this to the doctor, okay? There is no need to keep the patient in bed, so we can ambulate the patient as soon as possible to prevent DVTs or blood clots, okay? When the catheter is removed, we have to monitor the patient for urinary output. A patient that is not urinating or is oliguric, that means that there is trauma or the patient is retaining urine somehow. Okay. Initial voiding should be red in color and contain clots. This is mostly once you remove the 3-way catheter, and it should be it should be red in color and contain blood clots for a few days. Okay. And then eventually the color will turn amber in about 2 to 3 days, or at least a week, okay? Another thing that is normal once the patient, they remove the 3-way catheter after the procedure is dribbling, and it might last for several months. So advise the patient not to be scared, okay? So dribbling is completely normal, all right? Expect an output and should be 150 to 200 milliliters every 3 to 4 hours. If If the patient is not able to pee, it doesn't matter whether the patient had a TERP or had another procedure. If the patient is not able to pee, we have to call the doctor, okay? No lifting and sexual intercourse for 2 to 6 weeks.